Today's National Fentanyl Awareness Day, and we are continuing our morning-long discussion on the ongoing fentanyl crisis here in our central San Joaquin Valley.
Right now, we have the Chief of Police for both the Fresno Police Department and Clovis Police, Chief Paco Balderrama and Chief Curt Fleming. Good morning, gentlemen. Thank you for your time.
Thank you for having us.
And for being here. Let's start with you, Chief Balderrama. Can you explain how your police department is working with the feds in dealing with fentanyl?
We're very fortunate here in the Central Valley to have great partnerships with all of our federal partners, but especially the ATF and the DEA. And we formed a coalition that we call FORT. And this is a team that responds anytime that we are exposed to what we think might be fentanyl. We know that it's very, very dangerous. We don't want our police officers to get exposed and possibly overdosing. So we give them a call, and they help us not only to process the scene safely, but also to investigate it. And this is something that we're doing more proactively. We're not treating overdoses just as simple overdoses. We are looking to the root of the problem. Who got them the dope? How did they get it? Did they know that there was fentanyl in it? Because it's a very, very dangerous drug. So our partnership with the DEA is really critical in this effort.
Can you drop some numbers on how, have you noticed a huge increase in cases of this?
It's going up across the country, and it's very alarming. That's why we're doing this right now, is because it's something that is very, very scary, especially for teenagers. Last year we had 34 people overdose and die. Fort responded to over 81 different exposures, including police officers. So this is something that is, it's a growing trend. We know that fentanyl is a synthetic opioid that can be created without having to wait on the growth of a poppy plant. So it's, it can be very beneficial to the drug trade, and it's on the rise.
Chief Fleming, what should parents, what do they need to know? What do they need to be looking out for to make sure their kids are safe, or can they even do that?
Always checking online, checking on their phones, what they're doing. That's the #1 go-to when we work with the FORT team, DEA, Fresno PD. We come onto these scenes, we want to go to the cell phone first, because that usually takes us back to the dealer, to the root of the problem that we're trying to solve. Last year, overdoses have been on the rise. This year we're seeing a slight decline, and we think that's because of the education portion of it. Things like this with Fentanyl Awareness Day, getting that information out there. A lot of people are becoming educated on Narcan and actually having that in possession with them. So we're thinking that has a big impact on the overdoses and the unreported overdoses, because that's being utilized out there in the public.
You talk about social media, though. Why? How does that play a part in this?
A lot of things that kids come in contact with, and this is something that's impacting anybody under 50 and younger. We're seeing overdoses of young kids that are simply going online and looking for a prescription pill. They think they're getting a Xanax, and they're actually getting a Xanax with fentanyl, or a fakely produced pill. That's they take it for the first time, trying to do something cool and trendy, and all of a sudden they find themselves overdosed and possibly end up dying from it.
Chief Balderrama, how many pills did you seize last year?
About 125,000 individual M30 pills. And keep in mind, one pill is enough to, kill somebody, especially a young person. The awareness portion is just so important, because our young kids, everything is made easier through social media and through some of the apps that they can use to communicate. There's no, the years of going to bad neighborhoods to try to find the dope dealer are gone. You could seriously just send a message, make the connection, somebody will drop it off to you, and it's something very, very dangerous. A lot of times this is happening when the parents are two bedrooms down asleep, and they order this in the middle of the night, they get exposed, and then they wake up in the morning and find their loved one that's overdosed and deceased.
Chief Fleming, you talked about Narcan. We did have a doctor on a little earlier on Great Day talking about it and showing us how to use it for the nose. But do you think that every home should have this?
It's something to be aware of, and if you see signs and symptoms, educate yourself, potentially have that. About 4 years ago, all of our officers were given Narcan because we saw the impacts it can have. We saw the overdoses occurring, and we wanted to be able to try to save as many lives as we can. And I believe your officers as well.
Yeah, that's correct. I mean, this is across the country. Again, this is one of your best practices in law enforcement, is to carry Narcan. So every uniformed police officer who is out there as a first responder has not just one, but two. Because sometimes it takes more than one dose. A lot of people don't know this, that the effects of fentanyl last longer than Narcan. Therefore, you can give somebody Narcan, they can come to, and then they can succumb to the overdose again. So basically, with a fentanyl overdose, what it does is it stops that signal from the brain to the lungs to continue breathing. So Narcan, what it does, it intercepts that signal. So your body will continue its normal function of breathing. Well, once those effects wear off of the medicine and the drug kicks back in, some people take 3 or 4 doses. So not only do we have these in police cars, we have these at every briefing station, we have these at the front desk. We don't know who's going to come in needing help at any police station, so we make sure that it's readily available.
And the drug is so different. It can be in all sorts of forms, and that you don't know. Is the drug dealer different? Should we be looking for something different as a potential for the drugs?
And Chief Fleming can attest to this, but this is not your shady alley behind the dumpster type of situation. These are young kids. These are high school kids. These are people that are just making money on the side. They got a connection, somebody that can score some pills, and they're selling these online. But the fact of the matter is that we still have to hold people accountable.
For sure.
So we've been successful in actually filing charges for manslaughter or even murder in the 2nd degree. When you know the effects of fentanyl, they can kill somebody, and you go ahead and sell this openly to a young person that succumbs to the overdose, you can be held criminally liable for that.
I hate to say it, like 20 seconds, but last word, Chief Fleming.
This is a continually growing trend that we're seeing. It's not a problem that's going away. So thank you for having us on Great Day. Thank you for putting it out to the public education on the dangers of fentanyl and education, the things that are out there to hopefully save lives. And it's about getting the kids educated on what they're buying out there on the streets.
For sure. Well, thank both of you for all of your efforts and for coming on today, too.
Thank
we
you.
appreciate it. So if you know someone who needs help, whether it's for mental health services or substance abuse, call the number you see on your screen. It's 1-800-654-3937. Again, 1-800-654-3937. Real live people will pick up the phone and they will talk with you any time of day or night you call.